rural areas are, in general, sometimes don't get access or don't have the access. And growing up in an area, in this area, I sort of knew what the access needs were, and therefore I thought we'd go about and see if we could get a clinic here. Graduating from ECU and doing a residency the way I did, family practice, and doing a lot of external rotations. Coming back home, rotating here in Clarkton, made me realize that you can indeed come home. And so my purpose was to have a clinic in Clarkton. A lot of people are in financial need this day and time, and every penny counts. So if they can get their care locally, that's what they want to do. If they can get quality care, it's even better. It's just nice to be able to be closer home and have people to be able to use their local services, and to not have to travel an hour and a half to see somebody for something that can be handled here. The Golden Leaf Foundation was something that I knew little about until all this came into play, and with a couple of phone calls and some instructions and a few letters, I found out more about what the foundation was about, and we were pleased to have the opportunity to accept their award. Yeah, the services we have that are provided in our clinic from Southeastern Regional include x-ray services that we have on site. We have lab services. I always have had lab, but the courier comes twice a day, and that helps get our specimens there quicker, gets our results back quicker, and helps us make decisions faster about what we need to do with the patients and for the patients. Other services we have are the diabetic education and the diabetic teaching programs that we have, and that's been weekly, and we really enjoyed having that, and that's been a service that's been used, and we're looking forward to other services that are provided from Southeastern Regional, such as the cardiac programs and the GI, hopefully in the near future. I think patients have enjoyed coming. The first reaction is, I never thought I'd see a lobby like this anywhere in Blaine County. Secondly is, it's nice not to sit underneath someone when you're sick. But I think all in all, the comments have been, we now have room, it's so clean. But the staff here, they're great. They're well trained, they like people, they like their jobs. When that patient's here, that's why we're here. You know, and their needs are what we need. And in turn, that's what Southeastern is going to hear from us, the needs. So it's worked out nicely.
One of the wonderful things about being in Clarkton, where I had previously been at the county seat, is that this gets you even closer to those people who might be walking to the doctor, because this is a part of the county that is some distance away from most other medical centers, and it certainly helps with access. And that transportation issue was a big problem. But the delight of being in Clarkton is that you have so many just plain down-to-earth, good solid people that will maybe of meager means, but smile as they tell you about what's going to happen for Christmas with their family, and bring a jar of pickled watermelon rinds to you for Christmas time. So the people are just so delightful, and they seem to be perhaps less pretentious, and more willing to take you as a person too, instead of just as the doctor. That's one thing I've always enjoyed about working in a rural area, is that you have a relationship of a person to a person, and that they give you the respect that you give them. The biggest problem in the rural community is poverty in the biggest sense of the word. You have poverty when it comes to having a working family that doesn't have insurance. That's the biggest problem I have, is the honest people who won't come to the doctor when they need to because they know they don't have the money, but they have a job so they can't get any public assistance. Then you have the people who may qualify for a government insurance plan, but they don't have the money to get to the doctor. They don't have transportation that is secure. Or if you need for them to have some kind of specialty care, they again can't have a reliable transportation to get the full range of medical care that they need. Primary care has evolved in a direction that I'm very pleased with, because as a family medicine person, we were trained to have the broad view of health in a family, in a person, in a lifespan. We know more about the disease processes related to the core of our health issues of diabetes, hypertension, hypercholesterolemia, so that we're more focused on looking at the precursors, looking at the diseases as they're just getting started. It certainly is a lot easier to treat hypertension than it is to put somebody on kidney dialysis. It's so much better to treat obesity and hypertension before you've had your zipper through your chest. And primarily for our young people especially, I think the recognition of never smoking to begin with and prevention of lung disease. So we're trying to catch people before a disease becomes full-fledged, try to prevent its formation. And that has its own challenges, because it then again is quicker just to write a prescription than it is to try to get anyone to change your lifestyle.